MedsPLUS Consulting Pharmacy and Wellness Center, you're not just a number. We offer individualized care for each of our patients, plus prescription delivery and medication management.
MedsPLUS is there for any and everyone who wants a special touch with their pharmacy needs.
Call or visit today for a free consultation.
Bringing the pharmacist back to the community, MedsPLUS Consulting Pharmacy and Wellness Center.
Visit MedsPLUS Consulting Pharmacy and Wellness Center in downtown Birmingham at the new South Federal Building.
Good afternoon, everybody. Good afternoon. It is Monday at 1 o'clock, which means it's time for MedsPLUS Medical Minute Live. I am Dr. Pauline. We have Dr. Jennifer here with us, and we want to welcome you back to this week's edition of MedsPLUS Medical Minute Live. So it's mid-August, if you can believe that. And as families, we're all settling into the new school year. One challenge that always comes up as we go into this school year is getting kids to stay focused. And we want them to stay focused so that they can succeed in the classroom and succeed in life. So today we're talking about ADHD, or attention deficit hyperactivity disorder. And we're talking about some options that you can consider for your children to support your child's focus and learning.
ADHD is one of the most common conditions in children. It affects more than 11% of kids in the United States from ages 5 to 17. Now, one reason ADHD can be challenging is because it impacts something called executive function. Think of executive function as the brain's management system. It helps us play, stay organized, remember instructions, and control impulses. When executive function is weak, kids may struggle with time management and lose track of assignments, or have a harder time regulating emotions in the classroom. Medication can be very effective and sometimes necessary, but lifestyle, nutrition, and natural support also plays a powerful role in helping our kids thrive.
So when we talk about ADHD, it's important to recognize the symptoms or the signs. And that can be challenging for parents, because oftentimes when kids are at home, they're in a relaxed environment, it's their safe space. Oftentimes at home, there may not be as much structure as there is in the classroom. And so when our children go to class, some of their teachers may be noticing signs or symptoms that you don't notice at home. But when you're talking about recognizing ADHD, it's important to look for signs such as trouble staying focused in class. And so as they get older, maybe kindergarten, first grade, second grade, your teachers may be talking to you about, I'm having trouble keeping him or her focused. That's definitely a sign. Another one is difficulty finishing their assignments. And that's something that you may notice as children get older. Another sign is restlessness or fidgeting. So if you have a child that, for 30 minutes, 40 minutes, they're supposed to sit in their seats and be doing their classwork, but they're fidgeting, they're moving, they can't keep still, that may be a sign of ADHD. And lastly, impulsivity. So things like blurting out in class, interrupting, speaking out of turn, after they've been coached and recommended not to do those things and they continue to do them and they feel like they don't have control, that could definitely be a sign. So if you notice any of these signs or symptoms in your child or your children, definitely contact the pediatrician for a full evaluation.
That's exactly right. Managing ADHD often takes a team approach. Parents, teachers, and the pediatrician all working together. Here are a few practical strategies that families can use right away. First, we want to be consistent in our routines with our children. For example, same time for meals, homework, and bedtime, as much as you can, because we know sports and other activities may be delayed throughout the school year, but on most days of the week, consistency is key. Second, schedule regular physical activity. Exercise is proven to improve focus and the executive function that I mentioned earlier, by helping the brain regulate attention. I know when I exercise, I can regulate my attention a lot better as well. Number 3, mindfulness and calming activities. Even just a few minutes of breathing or stretching can make a difference. And finally, communicate with the teachers. Keep an open door, open communication with them. Ask about school accommodations like movement breaks, preferential seating, or extra time on tests. Now, I'm not an expert in all of the accommodations, but I do know that there is an IEP that can be requested for the child. And that's why working together with the school, the pediatrician, and the team approach is going to allow you to know about all the options available for your child to be successful in the classroom. These simple adjustments can reduce frustration and set children up for success.
Yeah, and I think it's so important to know that open communication with the teachers, with the education team is so important. We all have a dual role in that we want our kids to succeed. So work with your teachers, work with the administration. One of the things that we wanted to talk about, again, because we are pharmacists, is how can you support your children nutritionally and potentially naturally if you feel like they may be suffering from some of these symptoms. And of course, you always want to contact your pediatrician for specific recommendations or for a diagnosis. But if you're noticing some things, here are a couple of things that you can try. We know that nutrition plays a big role. And if your children are like my children, they definitely have a deficit in some of their nutrition because they just don't eat certain things. But research shows that nutrients like vitamin D, magnesium, zinc, iron, and omega-3 fatty acids can help support brain health and attention. And all of those should sound familiar if you've been following our medical minutes, because we've talked about those when we talked about immune health and overall health for adults. So at MedsPLUS, we partner with a wellness center to offer nutritional supplements for adults and children. And we've talked about this before, but specifically for symptoms like ADHD in children, we have a product called VitaChew for kids. And this is a multivitamin. It's chewable, and it's an overall multivitamin for your child. The key is that it has active folate. And we've talked about methylation before, how some people aren't able to methylate certain vitamins. So this contains the active form of folate. So if your child can't methylate, it's not a big deal because it already contains the active form. The second product that we recommend is called Omega Cell 1600. This is high quality fish oil that has balanced EPA and DHA for brain and mood. I remember when I was pregnant with my children, I took prenatal vitamins that specifically contained DHA because I wanted something extra to help with their brain development. This product contains those same ingredients, EPA and DHA. And then again, because we know that the gut and the brain are connected, you want to have your kids taking a good probiotic. And the one we recommend is called Probiotic Defend. And this just strengthens that gut-brain connection and helps with overall immune health. Now, if you notice, if you've tried all these things, your kids has a balanced diet, they're eating the healthy vitamins and they're having a balanced diet, and you notice that they're still having a problem with focus, you may want to try what we have is Full Focus Evolved. And this is just a unique blend of vitamins, amino acids, and botanicals that help regulate dopamine balance, focus, memory, and mood. It can be taken safely by adults and children and is ideal for parents who want to start a non-stimulant approach to helping their child have more focus.
Very good. Now, parents that are listening, I know that that's a lot of information Dr. Pauline just shared. But the one thing to remember, every child is unique. Some may need medication. Others may respond best to lifestyle changes or nutritional support. And often the best results come from a combination. At MedsPLUS, we help guide families through medication management, and lifestyle coaching. We offer the nutrigenomic testing to personalize the supplement choices, because that's what we want. We don't want to throw a lot of supplements at a child, have them taking many and multiple medications. We want to help you personalize and support what their body needs. Our goal is to help every child build a plan that supports focus, balance, and a happy school year.
All right. So if you have any questions, of course, you can always place them in the chat and we will answer those right here on air. Before we sign off for the day, I want to go over some of the events that we have coming up. Y'all know we are always in the community. Definitely want to go over some of the events we have coming up soon. And before we go over the events, though, Dr. Jennifer, tell everybody about our MedsPLUS Diabetes Education class.
Yes, Pauline, I would be happy to. So we offer diabetes education in a local library. We are currently ending our Ensley location at Renew Birmingham and Ensley. Had a wonderful cohort there. Everybody engaged, learning. We were so happy that we were able to add a nutritionist to the roster. So she's able to do one-on-one personalized nutrition consults. With the consults, it's not a one-time appointment. She's going to follow you along to help you to reach those goals that we guys deem necessary for you to be successful in managing your chronic condition. So very happy about that. The next one will be located in North Birmingham. There is still time to register for that class. The only thing we ask is that you have a diagnosis of type 2 diabetes and just give us a call and we'll get the rest of the information. That class will be starting the second week of September. The phone number 205-650-4636 to join.
All right. Thank you, Dr. Jennifer. The next event that we have is actually this Thursday, which also happens to be my wedding anniversary. But we'll be at the Summer Recovery Health Resource Explosion at the Alcohol, Drug Abuse and Treatment Center in Birmingham. So if you'd like to come out, there'll be a lot of resources there. And of course, this center is for helping people through alcohol and drug abuse. So we definitely want to invite y'all to come out to that on Thursday. It's at the Alcohol Drug Abuse Treatment Center in Birmingham. And it is from, I think, 10 to 2. Yes, 10 to 2. So come on out and join us there. And lastly, on Saturday, we'll be at the UNCF Birmingham Walk for Education. So again, we partner with the UNCF to present at this walk. We'll have a table set up. So if you're in the area, come out and join us so that we can walk for education. Now, Dr. Jennifer, if you will just tell everybody about other things that we have going on here, such as our Pharmacy and Wellness Center. I have a surprise coming up.
Absolutely. So for our Pharmacy and Wellness Center, we're so excited that we're able to do the remote patient monitoring, where we're able to check your vitals, such as your blood pressure and blood sugar, and we're able to counsel you in between your doctor's visits. We want to make sure that you're reaching your treatment goals as it relates to your blood pressure and your blood sugar. Some of the other things that we have going on, and we've talked about in the past, we're also doing our workforce development with Good Jobs Challenge, powered by Prosper in the city of Birmingham. We have just begun our last cohort of the year, which is for pharmacy technician training, our MedsPLUS Pharmacy Pathway Program. So we are actively placing students into healthcare roles with the pharmacy technician training that we're giving them, also prepping them to take the national certification exam as well. So on a day-to-day basis, we are filling your prescriptions. We are getting them delivered. We are counseling you on your medication. And also, not to forget, this time of year, a lot of people are reconnecting with their doctors. If you are Blue Cross and Blue Shield and you're covered by them, we're able to do your wellness screening in the office, and this will allow you to pay a lower premium. So you have to have a certain prefix to be able to do it. So give us a call to see if you qualify. And that number again, 205-650-4636.
Thank you so much. So last weekend, 2 weekends ago, we were at the Magic City Expo. It was an amazing event, tons of vendors selling all types of things, telling you about businesses in the Birmingham area and surrounding areas. And during that event, we actually had a drawing for a blood pressure cuff. Now, we've told y'all before, every home in America should have a blood pressure cuff or blood pressure meter, because we know that hypertension and heart disease are still the #1 cause of death in the United States of America. And most of us have high blood pressure and don't know it because we're not checking our blood pressure regularly. So we're going to give away a blood pressure meter, and we had people fill out a flip, put it in our little bucket, and I'm going to draw a name, and I'll close my eyes so I can't see the name, and we will give this person a blood pressure meter. And the winner is Yolanda Edwards in Troy, Alabama. So congratulations, Yolanda. We will be in touch with you on how we will deliver your blood pressure meter. But we want to thank everyone for entering the drawing, and we hope that you will use it to check your blood pressure and your family's blood pressure. Any closing thoughts before we leave today, Jennifer?
Well, I would just like to say, as we talked about the topic today with ADHD, just a personal testimony. I've come to realize that there is a such thing as adult ADHD or ADD. So if you start to experience some of these symptoms yourself, be sure and talk to your primary care provider. You are not going crazy. There is a diagnosis that can skip childhood and go straight to adulthood around peri or menopause or no pause at all. But pay attention to your body, what you're doing. That's why rest and eating nutrition or eating nutritious foods are so important. But if you notice these symptoms or they're not in your child, but in yourself, please, please, please bring this up to your PCP.
Absolutely, absolutely. So we want to thank y'all for joining this week's MedsPLUS Medical Minutes. We like to bring topics that we feel are important, relevant, and timely. But if you have some topics that you want us to discuss, please contact us, put them in the comments, and we will definitely do our best to bring that information to you. Thanks so much for tuning in, and we'll see y'all next week. Bye, everybody.
At MedsPLUS Consulting Pharmacy and Wellness Center, results matter. Don't settle for less when it comes to your health. Empower your health journey with a pharmacy that puts you first. Transferring your pharmacy is easy with our guidance. Plus, we offer prescription delivery and medication management.
Bringing the pharmacist back to the community. MedsPLUS Consulting Pharmacy and Wellness Center.
Visit MedsPLUS Consulting Pharmacy and Wellness Center in downtown Birmingham at the new South Federal Building.